To represent the lepromatous form, we've added 2 more leopards to the image. As you can see, they're pretty lazy, just laying on the ground munching on some greens. So lazy leopards for lepromatous form. The fact that they are lazy should help you remember that the lepromatous form is associated with a weak immune system. Also, we've shown 2 leopards to help you remember that in this form of leprosy, there is a T helper type 2 cell response rather than a T helper type 1 cell response. So the lepromatous form is associated with a weak immune response and T helper type 2 cells are activated. As we discussed a moment ago, the pathogens are unable to be successfully destroyed, so there is a high bacterial load. To help you remember this, we've shown the 2 leopards higher up on a hill that's covered with a ton of green mold. So high up on the hill and covered with mold for the lepromatous form is associated with a high bacterial load. To help you remember that the lepromatous form can cause leonine facies, we've shown a wild lion getting ready to pounce on these lazy leopards. So lion for leonine facies. This is an image of leonine facies, and as you can see, this individual has skin lesions on her face, resulting in thickened facial features that's thought to resemble that of a lion. Next, notice that we've added a skull right next to the lazy leopards. Perhaps this is the skull of one of the lion's previous meals. In any case, the skull is here to help you remember that the lepromatous form can be lethal. All right, now that we've covered the lepromatous form, let's move on to discuss the tuberculoid form. To represent this, we've shown our poacher guy with a big tubercle on the back of his head. You may have thought his head looked a bit odd, and now you know why. So tubercle on his head for tuberculoid form.